Are any home remedies safe or useful for coronaviruses? The internet is full of unproven COVID-19 remedies. We look at some and discover what works, what doesn't, and what's absolutely dangerous. It is normal to want to do what you can to speed up the recovery if you or anyone else is concerned about using coronavirus, COVID-19. However, though it is tempting to make miracle claims and cure all from Google, check the facts before attempting alternative approaches and follow medical advice. Care must be taken. It does not necessarily mean it's healthy just because a substance is labeled naturally, herbally, or antivirally. Mega-dosing or abuse of supposedly infectious substances may be harmful. The extent of coronavirus misinformation is so prevalent that a reply was published by the World Health Organization, WHO. It breaks down some of the prevalent misconceptions about unconventional care. This involves adding large volumes of pepper to your diet, ingesting disinfectant food, drinking excessive alcohol, and becoming too hot or low. None of these cures will destroy coronavirus, and you will most likely be seriously harmed. Other antiviral therapies which are potentially hazardous include iodine vapor inhaled through a dirt pipe and colloidal silver ingestion. When consumed by the body, both can be harmful. Iodine vapor also causes intensive mucous membrane irritation. It can cause chest strain and headaches, affecting lung and nasal membranes adversely. The head of the University of Southampton is a senior research fellow in public health. It could make the skin blue-gray, argyria, with colloidal silver, it said. Misinformation can be extremely harmful. Be very careful of people who make statements which the NHS or a generally accepted profession or society do not recommend. How secure is it to attempt? No specific medical treatment is currently available for coronavirus, COVID-19. However, if you have mild to severe disease, you can alleviate symptoms at home by using conventional medical care. Sleep, healthy eating, and stress management will also help the body combat infection. There might also be less controversial home remedies worth trying. Ibuprofen versus paracetamol. Early in a pandemic, news reports indicated that coronavirus could become worse through anti-inflammatory painkillers such as ibuprofen. Current government advice is that it is safe for you to take, but the medical helpline GP of Dr. Alex Standring encourages caution. Dr. Alex Standring. While ibuprofen is healthy, I would recommend that you take paracetamol if you have a COVID-19 fever. Interacting with other medicines is less likely, she says that. She says. Head adds that, the initial concerns surrounding ibuprofen seem unfounded and there are ongoing trials aimed at determining if ibuprofen really is successful in treating patients with COVID-19. In subsequent stages of COVID-19, a new type of ibuprofen might well be helpful. Researchers in London currently assess whether COVID-19 patients can be helped by a specific form of ibuprofen called Flarin. The medicine is made differently from ibuprofen normal and protects the stomach. Patients will be able to prevent respiratory failure and have to undergo aggressive procedures including ventilation. Dr. Richard Beale is the lead of the Liberate trial and is partnered by a proprietary drug-related testing company, the London Guy and the St Thomas's NHS Foundation Trust, King's College London, and Seek. Minerals and vitamins. There is plenty of evidence that the food we consume nutrients will strengthen the immune system and help avoid infection and help to heal. Vitamins B6, C, D, and zinc are used to prevent invaders and to promote immune cell production and antibody production. We have no particular proof that vitamin supplements work directly against COVID-19 or other viruses, says Standring. However, it is definitely harmful to be severely deficient in vitamins and minerals. Coronavirus can cause certain colds, with zinc showing that the length of the colds is reduced, she continues. In Britain, as we need much sunshine to generate it naturally, many people also possibly lack vitamin D. Vitamin D, therefore, the addition of vitamin D can be worthwhile for some, especially during the winter months. UK advice is now recommending that anyone over 1 year of age take a 10 micrograph vitamin D supplement into consideration, changing after the COVID-19 pandemic. Any alternative health, doctor suggests that vitamin C is an effective way of splashing an infection out of the body before you have diarrhea. It's unlikely that vitamin C would be toxic with further doses. Standring states, this is water-soluble. However, it remains unclear if it helps to take more than the daily amount prescribed. Heed states that there is no proof that vitamin C has beneficial or protective effects. And while vitamin D is interested in the interactions of COVID-19, we have only correlations and yet no proof of cause, he says. It is interesting to see whether the mega doses of vitamin C can contribute to the countering of COVID-19 related pneumonia in China. The research will report its findings in September using doses of up to 24 grams a day. Herbs and food additives. Infections have long been treated by herbs and spices such as garlic, ginger, echinacea, and pear. Garlic has allicin, an immune cell compound that allows microbial invaders to defend off. Garlic is great as a prebiotic for the intestines of the microflora, he says. It can sustain healthy intestinal bacteria, but I wouldn't eat large quantities. It says. An age-old cure for a sore throat is also suggested. The NHS advice on relief from symptoms like a sore throat is gargling or teaspoon of honey. It is worth noting that they are not going to destroy the virus itself, but will help make the patient a little easier. A COVID-19 herbal research review, led by Jeffrey Langland, virologist and researcher assistant to the Center of Immunotherapy, Vaccines, and Virotherapy of Arizona, is currently being conducted in the USA. But for a few months, the results are not predicted. Evidence for using herbs in the treatment of severe infections is not yet available, Sandring says. All the potentially harmful side effects and toxicity which is the issue, even though some have a positive impact. Recovery of the fragrance after COVID-19. The official list of COVID-19 symptoms now contains the loss of smell and taste. It is worth attempting smell training at home if you have lost your smell after coronavirus infection and are worried, says Standring. She states that, we believe the nerve endings of COVID-19 and other coronaviruses are damaging to the nose. The smelling will allow the normal function to be restored. Organizations like Absent will show you how to do this by re-waking the smell sensors using essential oils. In general, within a few weeks of recovery from coronavirus infection, people should expect to regain their smell and taste feelings. And knowledge with other viruses indicates that, within 1 year or so, 2/3 of those with longer-term problems will get their sense of smell and taste back, adds Standring. For more informative, home remedies for healthy life, subscribe to us. We are going to make more informative and helpful videos for health and healthy lifestyle. So stay tuned. Thanks for watching.